I've done nothing but rural healthcare in my career. I was initially attracted to it because you can really use all of the skills you're trained in. When I initially started practicing, for example, started a cancer care program in collaboration with the University of Colorado Cancer Treatment Centers, where the oncologist would see patients in my office. We would initiate treatment under their direction, and then they would come back and do follow-ups. So I got to be the cancer care doctor in the region because there was nobody else. So then we took a jump start from there, and in the early days of developing the cancer treatment centers in the area. And that's just one small example. I was the first medical director of the hospice program in the Roaring Fork Valley. I got to run an ICU. I got to be the first chief medical officer in 2 different hospitals. Just, you can develop your skills, your roles, and reinvent yourself to anything that you wish to learn, or your direction shows you that there's a need. That's much more difficult to do in an urban center when there's a specialist around every corner. So in that way, it's a constant learning opportunity, and that's really why I went into this. Is that you're learning every day. If you're not reading and learning every day, then you fall behind. Well, the biggest obstacle that I see for rural health at this point in time is payer mix and resources. The payer mix in rural areas has evolved to predominantly governmental reimbursement, specifically Medicare and Medicaid. So when you have 80–85% Medicare and Medicaid reimbursement, your fiscal margin is so slim that making improvements and keeping a forward-moving, profitable, growing enterprise is extraordinarily difficult. As the cost of care gets higher and higher and reimbursement gets narrower and narrower, our ability to take care of patients gets a little bit more difficult. So it's a cascade of events that I see really affecting the ability of rural health providers to do the best job they can. I viewed the Delta Hospital as a small group of people who take care of each other and take care of the community. The community seems very bonded and identifies with the organization. The board of directors and the county commissioners seem very bought in to the goals of the organization. So, and that reminds me a lot of where I started my career. So in that way, I'm looking forward to it. You get beat up a little bit in life, you sort of learn some lessons, and you just kind of want to just enjoy what you're doing. So, and I enjoy what I'm doing.